at the vasculitis, the classification, that is the modified Chapel-Hill classification. So we have some questions. The first one is, what is the medium vessel vasculitis and what are the disorders coming under this category? And second one is, what are the variable vessel vasculitis? So in this video we'll find these answers to these questions and learn in detail about this topic. So to start with the vasculitis, there is a large vessel vasculitis. So there is large vessel vasculitis. This will be our first category. So under the large vessel vasculitis, it includes the Takayasu. So it involves the Takayasu arthritis, as well as there is a giant cell arthritis. Next is we look at the medium vessel vasculitis. So the medium vessel vasculitis is nothing but it includes a PAN. PAN stands for the panarthritis polyarthritis nodosa. And next comes the Kawasaki disease. The Kawasaki disease. And then we move on to the variable vessel vasculitis. So the variable vessel vasculitis. So the variable vessel vasculitis, it involves the Behçet's disease, as well as the Cogan's syndrome. So let's recap. So we saw the large vessel vasculitis. So the large vessel vasculitis involves the Takayasu arthritis as well as the GCA, that is a giant cell arthritis. Then the medial vessel vasculitis, it involves a PAN, that is a polyarthritis nodosa. Then also the Kawasaki disease. And then we looked at the variable vasculitis, it involves the Behçet's disease and the Cogan's syndrome. Now we'll be looking at the small vessel vasculitis. So in case of the small vessel vasculitis, so this is divided into two categories. So one is the ANCA, one is the ANCA associated. So what is meant by the ANC associated? So ANC associated, it deals with the granulo. So it is the granulomatosis. So it is granulomatosis along with the polyangiitis. So granulomatosis along with polyangiitis, and this involves the Wegener. It involves a Wegener's granulomatosis, and there is also something known as there is eosinophilic. There is eosinophilic granulomatosis. So eosinophilic granulomatosis, and this is with the polyangiitis, and it involves the Churg-Strauss syndrome. Next comes the microscopic polyangiitis. The microscopic polyangiitis, so it includes the MPA. Let's recap. So we saw the small vessel, and one category under that is ANC associated. So it involves a granulomatosis with the polyangiitis, and that is the Wegener granulomatosis. The next, there is a eosinophilic granulomatosis with the polyangiitis, that is nothing but the Churg-Strauss syndrome. Next comes the microscopic polyangiitis, that is the MPA. So after this we are going to look at the immune complex mediated. So what is meant by the immune complex mediated? So when you look at the immune complex mediated, it involves the anti-GBM. So what is meant by the anti-GBM? Anti-GBM is nothing but it refers to the anti-glomerular basement membrane disease. Next, it also involves the cryoglobulinemic vasculitis. So this is nothing but it is known as CV. Then there is also the IgA. So the IgA vasculitis. IgA vasculitis, it is nothing but the HS purpura, that is a Henoch-Schönlein purpura. Next, there is the hypocomplementemic urticarial vasculitis. So this is nothing but the HUV, and it is the it involves the anti-C1q vasculitis. So let's recap here. So we dealt with the type of the small vasculitis, vessel vasculitis. It is the immune complex mediated. It involves the anti-CBM, that is antiglomerular basement membrane disease, and it is GBM. So G for the antiglomerular basement membrane disease. Then there is a cryoglobulinic vasculitis, that is a CV, and IgA vasculitis, that is a HS purpura, that is a Henoch-Schwann purpura. Then comes a HUV, that is a hypocomplementemic urticarial vasculitis, that is nothing but the HUV. And here it is the anti-C1q vasculitis. Now we'll move on to answering our question. So the first question we saw was, name the medium vessel vasculitis. So the medium vessel vasculitis, it includes the PAN. PAN stands for the polyarthritis nodosa. Polyarthritis nodosa. Next comes the Kawasaki disease. Kawasaki disease. Then we have the variable vessel vasculitis. The variable vessel vasculitis. So variable vessel vasculitis, it involves the Behçet's disease. It involves the Behçet's disease, and also it involves the Cogan's syndrome. Cogan's syndrome, that is a CS. So let's recap. We asked two questions. The medium vessel vasculitis, it involves the PAN, polyarthritis nodosa, as well as the Kawasaki disease. Then in case of the variable vessel vasculitis, it involves the Behçet's disease and the Cogan's syndrome. So this was about the classification of vasculitis. To learn and grow daily, please do subscribe.